Prime Hearing welcomes all moms and their babies as we discuss newborn hearing screening. Around 18 weeks of pregnancy, your baby hears their first sounds. By 24 weeks, those little ears are developing rapidly. Your baby's sensitivity to sound improves as the weeks go by. Sound can travel through your body and reach your baby. Very loud noises may still be able to damage your baby's hearing. Some of you may be thinking why it is important to have your baby's hearing tested. 1 in 250 babies in South Africa are born with hearing loss. Babies cannot tell us if they have a hearing loss. Identifying hearing problems as soon as possible ensures that your baby has the best chance to develop typically. Babies who have a hearing loss cannot hear nursery rhymes, your voice, or soft song. Hearing loss in babies is invisible, and even the slightest hearing loss could be a problem. Here is a list of some things a child with normal hearing should be able to do. Around 2 months of age, startles to loud sound, quiets to familiar voices, makes vowel sounds. Around 4 months of age, looks for sounds with eyes, starts babbling, uses a variety of voice sounds such as squeals, whimpers, and chuckles. Around 6 months of age, turns head towards sounds, begins to imitate speech sounds, and babbles. Around 9 months of age, imitates speech sounds of others, understands no, no, or bye, bye, turns head towards soft sounds. Around 12 months of age, correctly uses mama or dada, gives toy when asked for, responds to singing or music, and locates sounds on all. So what is hearing screening and how does it work? Newborn hearing screenings are safe and comfortable. Many infants sleep through the entire procedure, which usually only takes a few minutes. There are 2 common tests conducted to determine whether your baby has a hearing loss or not. Otoacoustic emissions measures your baby's response to sound by placing a miniature earphone and microphone in the ear. This is a very quick test that is not painful at all. Auditory brainstem response measures how the hearing nerve responds to sound through small electrodes placed on your baby's head. This test is not painful and even works best when your baby sleeps through it. What happens if my baby does not pass the hearing screening? The results of the hearing screening test show that your baby may be at risk for hearing loss. However, more testing is needed to confirm whether or not your baby does have a hearing loss. Does this mean that my baby is deaf? Not necessarily. There are a few reasons why a baby may need further testing. The most common reasons are middle ear fluid or infection, a blocked ear canal, or a permanent hearing loss. If your baby has been referred for further hearing test, the audiologist will do an in-depth hearing assessment for your baby. If there is a hearing loss, your audiologist will work with you and your baby to begin treatment services as soon as possible. How urgent is it to get retested if my baby did not pass the hearing screening? It is important to find hearing problems as early as possible because a hearing loss can prevent your baby from learning speech and language. The sooner you find out about a hearing loss, the sooner you can help your baby. Even if your baby passes the newborn hearing screening, you should still watch for possible signs of hearing loss as your child grows. If you have any concerns, repeat the hearing screening or take your baby for a diagnostic hearing evaluation. You can continue to protect your child's hearing by doing the following. Protect little ears from everyday noise hazards such as noisy toys, technology devices, and noisy leisure activities. The louder the sound is, the shorter the amount of time the noise exposure should be. Keep the volume down on everyday products and tech devices. Avoid purchasing toys and other products that sound too loud and use earmuffs in noisy settings. Although most hearing problems from ear infections are temporary, in rare cases frequent infections can cause permanent hearing loss. This can be problematic. Thank you for listening. Prime Hearing looks forward to helping you with your baby's hearing needs.